Okay. Hello. Thank you for the opportunity to present here. Our paper is about China's hybrid bureaucracy. We try to explain China's uneven response to COVID-19. We know that there were two stages in China's uneven response, at least at the early part of the outbreak. At the early stage, the early stage was characterized by concealment, but then the later stage, from late January to April 2020, was the phase of successful containment. What we're trying to do is explain what were the features that enabled this successful response and also the uneven response. We know that existing explanation for the success focus on two things. First of all, that discuss reckless leaders who deploy authoritarian measures such as mass mobilization at the community level or invasive surveillance technologies in order to accomplish successful containment. So this is one type of explanation, and another type of explanation focuses on the stupendous increase in in investment in public health infrastructure and technologies in the years that follows the SARS debacle in 2003. Our paper does not seek to contradict this perspective, but we are trying to offer a new perspective to look at the issue. And the key to our argument is thinking about China's bureaucracy and seeing it as a hybrid bureaucracy composed of two elements that are often contradictory. On the one hand, there is the rule-based element. The bureaucracy still works according to some laws, regulations, contingency plans. But on the other hand, there is a component that emphasizes loyalty to the party and its doctrine, and the cadre management system as an institution really epitomizes that component. In our theorizing, we also examine the institutional layering. We are arguing that the rule-based element has been layered on top of the cadre management system in order to achieve some incremental reform of the system and to achieve some rationalization of the bureaucracy. So we are arguing that these two different elements can explain China's uneven response. And we think that loyalty to the party and its doctrine has been crucial in understanding concealment in the first stage, but also understanding the compliance of the bureaucracy in the later stage, at the containment effort, once the party leaders publicly acknowledged that there was an epidemic and that it was transmissible to humans. But in this paper, we particularly explore China's rule-based element of the bureaucracy. And talking about rule-based bureaucracy in public health, we look at the laws, regulations, contingency plans that were formulated in the years that followed the SARS. We're also exploring the increased importance and prominence of experts in public health planning and also in response to outbreaks. Another issue that we look at is local policy experiments. Why do we pay attention to it? Because the literature on emergency preparedness, emphasize that having a written plan is never sufficient. The plan also needs to be put into practice through exercises, simulations, and training. So this is pretty much the argument, the theoretical framework. How do we seek to establish it and to generate a theory? Empirically, we are looking at two policy domains. One of them is public health. The other one is contact tracing. And in the public health realm, we see a strong rule-based component. There were a series of documents that were formulated following SARS, and some of them were even revised later on because of other outbreaks and adjusted. And what we're trying to do is read those documents very thoroughly and look for parallels between what is written in the documents and specific policy responses to COVID-19. And we do find that the documents actually have informed a real-world action. There are many examples for that. We will present only several of them just to let you have a good idea of that. First of all, there is a command center, both at the central level, the local governments, within hospital, that enables coordination between multiple bureaucratic actors. Then there is very active, very distinct participation of local government, and this is also in the document. And the Ministry of Finance and the Ministry of Insurance, according to existing documents, are responsible for making insurance coverage for COVID-19 hospitalization available, and that's a practice that was done during COVID-19. And of course, there was a lot of reliance on experts throughout this response. Now, so that was public health. Now, talking about contact tracing and technology, unlike the case of health, we don't have here clear blueprints, written documents. There is only one general blueprint that says big data technologies should be encouraged to employed in the health sector in order to overcome all bureaucratic fragmentation. And we have all sorts of local experiments in which local governments have collaborated with private sector technology companies to find, to explore, devise all sorts of local health solutions. And this collaboration actually informed a collaboration in technology and contact tracing during COVID-19, so the infrastructure was already there. And in addition to that, the grid management, so the lowest level of local government, like the neighborhood level of local government, before COVID-19, already worked in collaboration with the health system in order for achieving public health objectives, such as identifying chronic disease patients or people at risk of chronic disease within the community and informing hospitals or local clinics. So our argument is that all those local practices constituted part of the preparedness that China had already had some direction, some idea of where they would go, and then that in later years, all those practices will be codified and formulated into laws, regulations, and contingency plans. So this was, in a nutshell, what we have been doing in this paper. And as I said, we try to emphasize the increasing importance of rule-based type of bureaucracy in China's response. And we also think that in the near future, this trend is only going to be reinforced. Why do we think so? First of all, China's paramount leader, Xi Jinping, said in multiple occasions that he wants to promote the rule of law. And Xi Jinping has a reason for doing that. He thinks that through this rule of law, it will be possible to have central control over the bureaucracy and local governments. And also, after COVID-19, Xi Jinping already announced that he wants to see revisions to some laws which he named. And following that, China's National People's Congress worked vigilantly at revising them. But even if this trend is going to be strengthened, some pitfalls remains. As I said earlier, after SARS, there were very significant public health reforms that were crucial for facilitating the response to COVID-19, but these reforms were enabled because the legislation or regulatory rulemaking process involved elaborate consultation with experts and with key societal stakeholders. But in the current political atmosphere of fear and censorship, this may not be, consultation may not be as effective as it was in the past. And also, the component of loyalty to the party, the cadre management system is still an important part of the bureaucratic apparatus, and therefore we might see other episodes of concealment in the future. Thank you for listening to this presentation, and I'm really looking forward to your comments and feedback. Thank you.